Hi everyone, in this video I want to talk about cost of healthcare and especially cost of healthcare for diseases like cancer or really long-term chronic illnesses which have escalated over time for someone and that needs expensive medications for them that they can't afford, their family can't afford, and they are having a hard time getting access to the right meds. Now, having lived in US, I do know there are some companies that if you appeal to them, they might be able to give you drugs at a cheaper rate. Sometimes that can happen. If you see a doctor who has suggested a particular medication for your health or for your parents or any other family member's health that is overtly expensive and not covered by your insurance, as a pharmacist in US, and because I used to be involved in the conversations with insurances to know what was the decision making process going on with them, and also because I did my MHA in US, where as a healthcare administrator I understand the administrative end of these things a little bit. So sometimes you can negotiate a price with a hospital or a clinic. Sometimes you can negotiate a price with the doctor itself. Sometimes if your insurance is good, they will also give you alternative medications that you could try out that are much cheaper and affordable for the patient. And if you have a good pharmacist, like how I and people in my pharmacy were, we would always try to get the right information from the insurance companies to give to the patient and the doctors, so that the doctors could change the patient's medications if they were too expensive for the patient, or if the insurance was denying the use of a very new expensive medication and wanted the patient to first try out older medications. Because this is a problem with healthcare. Sometimes if you are a new doctor, or sometimes you are an overtly enthusiastic doctor, or if you are also an ignorant and incapable of discerning patient needs doctor. Many of these kind of doctors exist globally. It's not simply something that happens in US. Currently I'm in India, so I've met some of these doctors in India and US. I didn't even personally meet any of these doctors who are of this category. Most of the time the doctors I have worked with were very cooperative, because I lived in a state where people are respectful of their job, people are respectful of what a pharmacist suggests to them when they get information from the insurance companies. People are patient care oriented, and because I lived and worked in a state like that where care is involved in the steps of processes that people do, most of the time in our pharmacy and with the people I worked with, I didn't face these challenges of medical gaslighting or medical professionals not understanding the patient's perspective. But unfortunately these kind of doctors do exist. I know in my own personal family doctors who work in US as well as in India who are like this, who do not understand the patient perspective, who do not understand the patient's limitations, who are more interested in making money or just listening to very myopic view about healthcare delivery. And for them, whatever latest jargon they get duped into thinking is the best regimen for a patient, they will do it irrespective of whether it's too expensive for a patient to afford. Many doctors, if you really are a caring doctor, a deeper level patient treatment oriented doctor, you will understand that the patient's treatment is not simply about the medication. It is also about their financial factors. It is also about the financial factors of the or other caretaking factors that the patient and their patient's family will have to go through when they have some expensive medicine needing disease or very long term debilitating disease like cancer. And currently I have actually cancer which is undiagnosed by a doctor because of certain medical goof ups that have happened and certain lack of comprehension of Indian doctors in actually reading through a medical report. And also because I didn't go to a cancer doctor, I had gone to other general practitioners. But despite that, even other general practitioners or even specialists were not able to look into my reports in the area specific to their expertise as well. So that is a different medical gaslighting related issue that I have posted on in the past, and I can keep speaking on this topic about different elements of medical gaslighting or medical ignorance that I have faced from in my personal life to just meeting someone as a patient. And but the main thing is, because I had a healthcare degree and a partial degree, unfinished degree, but the degree that has given me 3 degrees that have given me the insight on being able to read blood reports. I don't remember usually the pathological terms that are needed to diagnose a particular disease because I don't work in that field anymore. But even though I don't work in that field, I do have the theoretical knowledge. So anytime I can open a pathology book or a pharmacology book or a diagnosis book or information relevant to these fields to actually have similar conclusions as a person who actually works as a pathologist, who actually works as an internal medicine doctor, or who actually works as a cancer doctor. It's just that my degree of knowledge is not as deep as any of these people, but I have enough expertise to understand when they are giving me the right diagnosis, when they are giving me the false diagnosis. And when I was getting false diagnosis or partial diagnosis, I had to sit through my own blood reports to figure out what was going on with me. And that's how I came to the conclusion that my symptoms were aligning with cancer. And there was one report where a question mark was present about a particular cancer, and that was actually because of some medical error that report had come up, and that's why the person had put a question mark, because if that error hadn't happened, that report also wouldn't have been generated as a result of an error. So sometimes how people say that in the bad there is something good involved. So when someone does an error, sometimes in the error also certain good things can happen. But the mistake that was ensuing after the first error is people in India do not speak to each other well. The communication channels in India are very siloed, especially in the hospitals. So one doctor who took the samples didn't talk to the doctor who's testing the sample. They could have spoken to each other and even me to have actually figured out where the error was and why the confusing report was showing up. But because people don't speak to patients, people don't speak to intelligent patients, people do not acknowledge that a patient can have some information that is relevant for a doctor to diagnose a patient. All of these reasons are why misdiagnosis, partial diagnosis happen in healthcare systems, not simply in India, but this could have unfolded for me even in US if I had this same level of incompetency and people not speaking to each other, people not communicating with their patients appropriately. If it was happening in some other hospital healthcare system, it was very possible to happen in any other global healthcare system other than just a Indian healthcare system. But nonetheless, my reports, even though my report showed that I had cancer, I didn't go and investigate it. Firstly, because I was really debilitatingly sick, and I was really not having just one cancer symptom, but I was having some other diseases also going on and some other life problems and challenges also going on simultaneously at the same time. So when you are hit with 3-4 different problems, and then there was some financial box, because when I was really sick, I couldn't even spend 5 minutes or half an hour going to the bank to get money from the bank to go and even get simple money for my food. That level sick I was, and because I was that level sick, when I can't go to the bank to go and get some money from my, and I wasn't working. So if you don't work actively, you don't have a current steady income. So if you don't have a current steady income, whatever is there in your current active account, if it dries up, you have to go and get money from your savings account, and those steps and processes take a while to do. And I was so sick for a while that I forgot all my online IDs and passwords passwords and some glitches were happening. Maybe my computer got hacked, I don't know what happened, but I couldn't do online banking. Because I couldn't do online banking, because certain things are not allowed in online banking, because certain banking required a long line, because there was COVID also happening, and COVID related banking activities also got shut down for a couple of years. So in those same years, when all these things were transpiring, things outside of my control as well as things within my own capacity to do, that were not executable because I didn't have the physical health to go and pursue those things. So I had to just sit. And there was a logical reason that God made me sit through a cancer diagnosis phase, where first of all, I didn't diagnose myself immediately after the testing was done. After a couple of months after my blood tests were done, and I was still sicker than before, and I was getting sicker on certain days, I sat and looked through my reports and examined my reports to figure out what was going on. So it took me about 6 months to a year after I had done those tests to figure out that I do have indeed cancer. And then, even though I got some of my financial blockages resolved, the problem was, because there was one cancer stage and one pre-cancer related thing going on with my health, I also knew that this complicated thing might be difficult for some doctors to understand or diagnose or treat. Because doctors, if the doctor is not even able to diagnose one disease, imagine, will that doctor have the capacity to diagnose two diseases running through a person's body at the same time? And I was not simply having two diseases, I was having allergies. And later on, much later, I realized my allergies, inflammation, everything was correlated to my cancer. Because what was happening was, initially, when this is how I figured out the trajectory of cancer that developed in my body, related to the one kind of cancer that is yet to be diagnosed by a doctor. So for that kind of cancer which is yet to be diagnosed by a doctor, whose steps of diagnosis are present in my blood reports, when I initially was getting some symptoms related to that cancer, now I can correlate that it was possibly symptoms related to this cancer that was developing in my body. So one symptom was extreme allergy on my skin. Second was a heightened inflammation that started happening. Both the allergy and inflammation, why were they happening? Because my body was getting toxed out from multiple chemical exposures. Because that cancer or many other cancers actually currently have been correlated to pesticide poisoning and pesticide exposure. So at that time, when I was not getting a diagnosis from a doctor, long before I did the test to show that I have actually cancer in my body, before I was only experiencing symptoms of allergies. And heightened allergies, such heightened allergies that even small level of things that I wasn't allergic to earlier, or things that used to only provide sneezing for me previously, were causing much more distressful symptoms. I also went through near anaphylaxis like stages for a few days when I was consuming food that I didn't know I was allergic to at that time, because I hadn't done an allergy testing. But later on, the testing confirmed that the reason why I was choking when consuming something was because my test showed that I was allergic to possibly one of the ingredients in the food I was eating. So all these things that were happening, the heightened increased allergies that started happening in my body, was happening because my body was in distress, and it was giving me a distress signaling that, don't consume these foods, don't consume these health harming things, because you're already in a heightened state of distress. So when body is fighting, say, allergies and cancer and chemicals and cancer that is coming from possibly chemicals that are harmful to the body is giving you a warning system: do not consume these products. Which is what started happening to me. I was getting problems every time municipality or a housing society was spraying pesticides. I was having problem if I went for a while, when I did have some money at the time, I decided, let's try to find a place which has cleaner air than Navi Mumbai. So I live in Navi Mumbai, and I went out of Navi Mumbai to figure out, is there a place outside of Navi Mumbai where I will not get this breathing distress from chemicals being sprayed around in my home environment or building environment, or even society environment. I used to love going out for walks in nature. I used to love taking 1 hour walks as an exercise, but I wasn't able to do that because I was getting breathless. Right now today also I'm getting a little breathless because I just ate some food, and when my blood is toxed out right now and the blood supply is going to my stomach, it is also a little difficult for me to breathe, because these are the kind of symptoms you will start having when you have cancer or blood related disorders going on in your body. That if your blood is contaminated by poisoning from chemical contaminations and other things, and there is only a limited amount of blood that is pure in your body, that pure blood will first focus on the primary function that it was assigned. So before I started this video, my body had eaten some food and it needs to be digested, and during the digestion process blood flow has to go to the stomach. So since my major blood flow or healthy blood flow is going to the stomach, now because my body is even though the pulse oximeter is showing I have 95% perfusion and all that, whatever SpO2 is 95%, but that doesn't mean that my entire body's blood is pure, because I have that kind of a cancer that has impacted my blood's health, because of which I don't have good clean blood. So now I'm getting breathless while I'm speaking because my body can't focus on two activities, and this is how cancer is debilitating. That's why sometimes if you have certain kinds of cancer, you are not able to function like a normal human being. You will not be able to breathe, you will not be able to walk gracefully. Some days when you're healthy is because you have some pure blood in your body at that time, but after a few days, if you have eaten enough crap, or say, why am I saying eaten enough crap, because out of the food that I'm eating, if I have eaten a sandwich with 5-6 ingredients, if any of those ingredients are contaminated with pesticides, any of those ingredients are contaminated with heavy metals, the spices in it or something, and any of the ingredients in it are harmful to my health on a already toxed out cancer ridden body or a highly allergic body also, because these kind of symptoms can happen to a person who has heightened allergies, heightened inflammation, heightened poisoning or cancer. Any of these group of people may face some of these similar symptoms that I'm talking about in this video. So if you have heightened allergies, if you have heightened inflammation, if you have some cancer developing in your body, if you have some toxin related high level poisoning going on in your body where your organ systems are overworked fighting these toxins or cancer or allergens or multiple combination of things that are the body is fighting, and that's why you have the heightened inflammation. These are the logical reasons why this will develop in your body. They can all develop simultaneously or slowly over time, which is what happened to me. All of these symptoms that I'm talking about that I have currently is not something I developed today or yesterday. It is something that has developed over 8-10 years or 4-5 years of exposure to multiple things that are toxic to my body, that initially when the level of exposures were at a level where my body could fight it, I was okay. But the moment my body stopped getting overloaded with things that it can't fight anymore, that is when I started getting extreme symptoms that were undiagnosable by many doctors, from emergency room doctors to regular doctors who, like people, a cardiologist, if you have breathing trouble, should be able to figure out that a person who has breathing trouble could have lung problems, could have blood problems, could have circulatory system problem, could have kidney problems, could have cardiovascular system related problems, could have even thyroid related problems. These are at least and cancer related problems. These are the 7 minimum fields of cardiac health related fields that they should be examining, and even poisoning related problems. But unfortunately many doctors do not understand the severity of what happens to a patient when they have poisoning, when they have breathing problems arising from, for me, what is, I will maybe post another video about the trajectory of what happened, because that will confuse otherwise other people. But the reason why I'm making this video is because I saw a post online where the story said that there was this teacher who was a very good teacher in his school, and he motivated many of his school students to do well in his school. And one day he got suddenly arrested by the cops. Why? Because he was suddenly caught selling illegal drugs to kids in the school. Even though he was a very good teacher, suddenly one day he started selling drugs. Why? He said that the reason why he started selling drugs is because his mother got cancer and he couldn't pay for her medications with the salary he had. So in order to supplement the salary, he went through this because he really loved his mother. And if he given a choice, he said he would have done that again. Now, whether it's a true story or false story, we don't know, but there are many people who are like this, that if they love their family too much, some people are ready to cross the ethical zones or moral zones in order to gain money if money was suddenly a crunch in their life. So for such people, like this person was in an ethical dilemma. Even though he loved his students, he decided to ruin the life of those same students by selling drugs to them, illegal drugs. So, and even legal drugs possibly, because even legal drugs are sometimes illegally sold off the label in countries like US. So anyways, whatever he was doing and selling led to his getting caught, and the universe stopped him from going in a very darker path. But people like him who are going into this binding crunch where a doctor is suggesting a very expensive therapy is required for someone who has organ damage or cancer or high allergies, or needing a kidney transplant, or needing a liver transplant because their kidney or liver got damaged. First of all, while it's true that what the doctor is suggesting for the patient is the current line of therapy, many of those doctors, if they do not have empathy, if they do not have understanding of a patient's financial situation, if they do not even think about the socio-economic circumstances of a patient's life, they will suggest therapies based on elite customers, therapies based on people who have insurance, their therapies, rather than based on what is the current socio-economic status of that patient. Because sometimes based on the socio-economic status, certain things can be changed in the therapy that a doctor is suggesting for you. Because I was in a financial bind, because I am a healthcare person, I understand the pros and risks and benefits of even a medicine given to me. If I am going through 3-4 different health problems at the same time, and if a doctor suggests a particular medicine to me because he has detected, say, I have X disease in my body, he has detected I have X disease, I know as a person who is educated in this field that I have X plus YZ also happening with me. And if I also know, or if after taking the X medication the doctor gave me, I got a side effect which is impacting the Y and Z condition in my body, should I continue taking the X medication? No. There is a risk versus benefit you have to do to figure out whether that medicine for X disease needs to be taken. For a very simple example, I had just 1 point high cholesterol level, 1 or 2 points high cholesterol level, total cholesterol. Other cholesterol parameters weren't high. Now in US, if such a patient would come to a doctor, no doctor will give a medicine to the patient. They will say do exercise, do preventative care strategies of eating better food, and even if the patient says I'm eating healthy, they will still suggest do this for a few months before you take any medicine. And I went to a doctor not to get medicine, but some doctors are so stupid, they consider all patients as hypochondriacs who want medications from them. But no, not all patients want medications from doctor. And doctors are not supposed to treat a patient based on the medicine they write, which is a false paradigm many doctors fall into, or many patients fall into, thinking that true treatment is just taking medicine suggested by a doctor. No, a doctor or a true doctor is not simply about a medicine, or not simply about a surgery that they will suggest. A true doctor is actually healing a patient based on what is going wrong with the patient. So, a true doctor or a true healthcare healer will suggest first that, and this is the kind of therapy that is going on in US, at least in the pharmacy field. This is what we are being taught, that the first line of therapy for a patient. And as a pharmacist, I was learning all doctor related protocols only, that what is the American Heart Association suggesting for a cholesterol patient. It is not something that a pharmacist association has written is as mandatory for a cholesterol patient, but the Heart Association, which has been treating patients for decades and centuries, they have come with this protocol that the first line of therapy, when only slight cholesterol is high, or if you are in a borderline range of pre-high cholesterol level, you need to, first line of therapy should be exercise and other measures, dietary measures. Same with many diseases. If it is cancer also, even though cancer related therapy hasn't reached this level, but I would urge some cancer related treatments also to start looking into this aspect. Because what happened with me, one, that was a pre-cancer thing which was related to, I have posted in my previous video on this, it was related to the thyroid nodules that I had in my throat area, nodules that have taken time to develop from nodules to benign lesions in over 10 years of its existence. Now these lesions had developed because in the last few years, because I don't do a job, because I'm mostly involved in some social media stuff, because I was posting a lot of things in social media while I was really sick, because I was not able to do physically strenuous activities. I was not even able to go for 1 hour walks, or carrying even 5 kg load of groceries was too heavy for me. So when these phases of life started happening, when I'm really physically incapable of doing physical activities, I was doing some mental activities. I'm good at both mental and physical. I'm not great at actually physical activities. I was never like the epitome of physical fitness, but at least I had average level of physical fitness, which went from average level of physical fitness to really poor level of physical health. But mentally I was always a very good student, so I used my student knowledge or other knowledge that I was gaining at that same time of illness to devote my time in posting some social media things, educational stuff related to health or related to my personal life. Whatever I felt like writing, I was writing. Because I enjoyed writing, because I enjoyed speaking, I started doing those kind of online social media posting. Now I couldn't speak. I have been only there was a gap of time when I wasn't posting anything on YouTube, but I still kept writing because that was the easiest thing for me to do. My brain was working, my hands were working, so I did what my brain and hand could do. So when you are going through something serious which needs expensive treatment, and you don't have access to money or insurance, or other health problems are going on that you can't even take yourself to the doctor, yes, you can. I could call an ambulance, but what ambulance would come? When I went to the ER of that same hospital, they are not even acknowledging that I have a problem. They sent me home saying nothing is wrong with you. Even when I was at the worst stage of cancer, a few months after that only, when I did these cancer tests, I did some blood tests, and after a few months after those blood tests, when I correlated a couple of those blood tests that I had done, after a year I figured out, after doing some blood tests, that I have cancer. So it took me nearly 1.5 years to figure out I have cancer. And in that 1.5 years, whenever I went to different kinds of doctors in the first few months of the really severe stages of my cancer, none of these doctors even have an inkling how cancer looks like in a 40-year-old, 30-year-old person. They just don't have a clue. They are that clueless, that distanced from understanding how a sick patient really looks. Just because a patient smiles doesn't mean they don't have cancer. Just because this patient speaks and is a younger age doesn't mean they can't have cancer. They can't have some severe illnesses. They can't have something that really needs addressing urgently in the ER. But unfortunately, these doctors are not trained only to understand anyone who's in some gray zones that befuddles them. These doctors are so dependent on certain tests, and even in those tests, if they don't scrutinize those tests appropriately, they are not able to diagnose certain things. Anyway, which is fine in the sense that there was a reason why this kind of medical gaslighting or incompetency happened with me, because I had better competency than them, which sounds very egotistical, but it isn't. I was ready to look at my thing, because whose life is at risk? If I die suddenly one day, I am at more risk, right? So even if the doctor doesn't care for the 1500 rupees I spend in seeing them, I have to care, and I can spend 1500, 15 lakh, 15 crore. I don't have 15 lakhs and 15 crore to spend currently, but if any time in my life I get that money to spend also for a cancer treatment, say I win a lottery and I have that money, should I go and spend it on a doctor who is incompetent enough to even read a blood report the right way? Right? Will I go to that institute if 10 doctors of that institute have messed my life up, or 2-3 doctors have messed it up because they are incompetent? They have competent staff, but if the competent staff don't speak to each other, should I go in such a place to get treated? Right? So that is one problem. That's why universe prevented me from getting the right diagnosis and because I don't have the right place to get the treatment. Secondly, I was having one cancer thing. So what did I do with the pre-cancer thing? The pre-cancer thing, that was the nodules that had developed, that can also get some cancer treatment from some surgeon in the hospital. What they will do, if they see a lesion, they will either give a medicine to close the lesion, or they will give a surgical option. These are the two most likely therapies they would have suggested. None of the doctors in India suggest anything like preventative care, but I am a very preventative care focused person, because that is what I learned as a pharmacist, and that I feel is the first line of therapy every patient should test first, even if they have the most debilitating disease like cancer. And which is why, because I was supposed to examine and explore this path, the financial blocks and challenges happened in my life. It was not like a sudden unfortunate series of events. It was an unfortunate series of events that were transpiring for me, but even in the unfortunate series of events transpiring for me, the silver lining in the unfortunate series of events was this, that there is someone who has to explore this path of what to do when you do not have appropriate finances, what to do when you don't have appropriate doctors to diagnose your disease, what to do even if after diagnosis the money you have is not enough to treat the disease that you have, or what to do when you have a complex set of diseases. These are the kind of dilemmas I was continuously going through in the last few years. So one by one, this is what I figured out, and this is what people who are really in a financial crunch, who are going into all these online websites to get funding for their kids' cancer, or their cancer, or their parents' cancer, or if not cancer, organ damage, organ transplant and all that. You can do organ transplant, you can get cancer treatment, you can raise the funds to get all these treated at the first step of the process. But after you have raised the funds to treat that disease, have you taken the measures after you have saved someone from dying to have the life that they need in order to not get that cancer again, not get organ damage again, not get some other disease again? Because most of these people who have had liver failure or cancer or any other really expensive surgery needing, medicine needing disease, many of these diseases actually have a root cause in the environmental factors of their life. And if those environmental factors aren't taken away from them, those patients will eventually die. In US, there is a thing called patient re-hospitalization related stuff, that US healthcare system being the most expensive in the world, one of the most expensive I believe, because it's so expensive and the cost of healthcare in a hospital is so expensive, that US government has started now tracking how long, or when a person was hospitalized for a surgery or health incidents, after that if they get re-hospitalized, they are tracking that in US healthcare. Why? Because they want to see that if a patient has got the right treatment in the hospital after that also, or is getting medicine also after being hospitalized, why is the patient getting re-hospitalized? And this is where people do not understand about any disease. I have also seen millions, and not millions, but let's say I have watched at least 10-20 videos online of cancer patients who got recurrent cancer after 2-3 years of having already been treated for one cancer. They either got the same cancer again after a few years, or if their X organ was detected of having cancer, now their Y organ has another kind of cancer. And they were two entirely different kind of cancer, but two entirely different kind of cancer can develop in your body from your environmental factors, because some environmental factors can influence 2-3 different kinds of cancer. Like very simply, the thyroid thing, that was a benign thing, it has a potential to develop into a cancer. It was not a cancer, it is a pre-cancer thing, that if that requires mandatorily that every few years I get a ultrasound or get a FNAC done to check the status of whether it has converted from benign to cancerous level. That is the protocol of the thyroid nodules that had converted into lesions. For the nodules itself are going to be monitored. That is the protocol that the US doctor had given me, that the nodules should be checked very regularly for via ultrasound to see whether they are changing in size. Why do they do that? Because if you have growth in any organ, a growth that is tumorogenic potential, that growth can convert into a large tumor over time, and that tumor can then convert into cancer. Or that tumor, if these small nodules had converted into multiple nodules here, that would have been also considered cancerous. If these multiple nodules had some other cancerous elements in them, then also it would have been considered cancerous. So they were not cancerous. Simply why? Because whatever was the root cause of this cancer like thing developing in this thyroid organ area, if those root causes are minimal or not as strong, then I will not develop the cancer. So same person, and what I figured out for my thyroid related problems was that phones, I was using a lot of phones. I used to put music on my phone and put the music on and fall asleep. Like I would put meditation music on and fall asleep, or I would watch something on Netflix and fall asleep. These things, practices I used to do in US. In India also sometimes I used to do these practices. So the phone was always near where? In this area of my body, and I would rarely use headphones because I was not using headphones, and most of the time the phone's radiation is coming, because if you turn on your phone for 3-4 hours, eventually the phone's battery life goes down. And whenever most phones battery life goes down, this is the thing I have observed in the phones you get in India, is that when the phone's battery life is going, the phone gets heated. And even some iPhones in US, I found that the phone used to get heated after low battery life. And when the phone is heated after low battery life, or 50% and less of battery life, that heating is happening because of the radiation being generated. And that radiation being generated is also increased radiation that is happening, that exposure is happening to you. So the more exposure I have in this area, where do you think my organ damages and cell damages are happening? My organ damages started happening here, where the nodules were forming now to protect my thyroid organ possibly, and I have some hearing related issues also that have started developing in my body. And a hearing issue where it's not that I need a hearing aid, but there are times when I can't hear properly what people are saying. If people are mumbling, I can't hear it. Or if people are speaking from another room, I can't hear it. Whereas 10 years back, I had the capacity to hear them. So these things can start developing, where it's not that data related to this is not there out there in the world in research papers, but the data is conflicted about these, because conclusive data has not yet to be found, but this is how beginning stages of any diseases are. The deeper conclusive data happens when more and more people like me will start happening in the world. If more and more people, if you consider, like say you take 100 patients to see whether radiation from the phone is causing them cancer, and out of those 100 patients, if I am the person who is using the phone for 15-16 hours a day and always keep the phone in this area, that's why I get say some brain problem or hearing problem or thyroid problem, and where there are 99 other people who do not do this, who only use their phone for 1-2 hours a day, are they going to have the potential for cancer using the same phone that I am using if they are only using their phone for 1 hour or 10 minutes or 5 minutes? No, right? So when you have gathered the data whether cell phone usage causes cancer, if you gathered data from 100 people where none of them were actually using their phone for more than 5 minutes or 30 minutes, maybe you will not see data of cancer. You have to also see if in those 30 minutes also, if everyone is using their phone for 30 minutes every day, this is how, you have to scrutinize the methods of what was studied also. Because if they studied it for 30 minutes a day, if everyone's phone was fully charged and they were speaking for 30 minutes, maybe again they will not develop cancer. But what if one person is speaking for 30 minutes and their phone is at 10% battery life, someone's and is overheated and showing more radiation, and another person's phone which doesn't get overheated, what if there is brand to brand variability, provider to provider variability, cell phone tower to cell phone tower variability? All of these factors also add to the radiation exposure to someone. So because of which lot of data still needs to be gathered to conclusively prove if you are getting cancer from cell phone exposure or radiation from phone. Yes, but if you are already observing that having phone and using a lot of phone, like how I observed, like using a lot of phone, using hot, when my phone is really hot, when it's below 50%, at those times I'm getting some health distress, hearing problems, and if my problems are de-escalated if I don't do these, then it's better, right? A few months back when I had this nodules here, this area was much more lumpier, but because I have slowly stopped using my phone at a low battery life, and also I also try to not do the same practices I used to do before these benign nodules were detected. I realized that slowly the thyroid related symptoms have de-escalated for me, and I do not, and without even getting a surgery, without even getting the any medicine injected here, because at that time getting a medicine injected in my body was a risk factor too, because I was at a heightened allergy phase, and because of heightened allergies, even inserting a needle sometimes can be allergenic to you. A needle or a chemical in your body when you are in heightened allergy states can be a risk versus benefit, and I didn't want that risk of being injected by anything at that moment, because I realized if I do preventative strategy and I can reduce the pain also in this area. I used to have pain in this area, that pain has gone. I can do another testing when necessary, but right now I'm avoiding going and doing a testing, because unnecessarily, needlessly subjecting your body for testing also, because again for that testing also I will need someone to insert a needle in my area of the thyroid nodule. I can do a ultrasound where I will not need a needle, invasive needle inside, to see whether the nodules have gone away or the lesions have healed. I can definitely do that. But when monetary things are in a little bit bind, you analyze the risk versus benefit of doing a test. You can, if you are poor, if you are having financial crunches like me, if your money has to go far for you because you have other medicines to buy for yourself or someone else, whatever is your financial crunch, what is the better option? Is the better option to sell drugs, illegal drugs? No, that is not the better option. Is your better option to do some unethical practice to gain more money? No, when a wiser choice, better choice is present, for me the wiser choice, better choice was reducing the radioactive exposure from my phone, which helped me. And when it helped me, should I talk about it or should I keep quiet just because not enough data has been gathered by someone else? At least if I speak about it, someone else can do the right clinical testing, right diagnosis, right research work, right appropriate clinical trials or whatever is needed to prove this or disprove this. And anyone else who, after listening to this video, if they practice it and they actually see that their pain is going away, would that be a better thing or not? To have a phone which doesn't have either high radioactivity, you can start buying phones which don't have high radioactivity. You can make that responsible choice. You can make the responsible choice of, and there are already so many people who are promoting this already beforehand only, that in the night time don't have your phone in the same room as you because of the radioactivity reasons. There are other people who promote that turn off your phone for a few hours, do not be constantly hooked onto your phone. There are other people who suggest, because there are multiple reasons for doing it and they are all interconnected reasons. One could be because of radioactivity, one could be because of phone addiction, one could be because of overuse of phones, which can ruin your eyes also because of the brightness of your phone. Same thing with the noise from the phone that could damage your ears. Not simply the radioactivity, but if the noise is of not good quality, again your ears could be damaged or other cells could be damaged. So for health, different kinds of health reasons, these people are promoting this. But if multiple reasons are also involved in having a beneficial effect on your health, should you do that practice, or should you only run after medicines to cure something that could be cured for free by doing certain free things and simple things of life? If you are financially crunched, should you definitely try this? Or when you're financially crunched, should you sit and beg and only run after money or free medicine and waste your time doing something which may or may not work? Because again, medicines don't always work. Medicines may have side effects. Always gaining a medicine that the doctor is suggesting is the best medicine for you may or may not be the best medicine for that patient. That also many doctors don't understand. That's why there are insurance companies. Many people get pissed off by the insurance companies of US. I don't know about the insurance companies of India or and how ethical or unethical they are, but in US companies, the reason why certain laws and regulations and restrictions are there for medicine usage is this, that if there are 3 medicines available for a patient for a particular disease, and if the doctor is suggesting the most expensive medicine without trying out the cheaper medicine for the patient, you are increasing unnecessarily the US healthcare costs. So people who in government or normal people, when they sit and complain that medical cost and cost of healthcare is so high, so expensive, so this, so that, why? Because you're not practicing. Those people are the same people who don't practice the saner ways of healthcare, which is preventative care, doing the simpler things in life, doing some things that are not easy as popping a pill, because not using your phone for 8 hours, 10 hours in the night, keeping your phone in a different room, not continuously being hooked onto a phone, wearing a headphone while using a phone. All these things are extra things you have to do, even though they might be slightly freer things to do than a medicine. They are actually more health harming and more aligned with your health if you do the right practices. Whereas medicine may not actually always be aligned with your health. That is why medicines usually have so many side effects also. So when a patient, and I saw videos of certain cancer patients, there was a girl whose video I saw who had to stop taking her cancer medicine, and she luckily had a good doctor who understood that why she should stop taking the medicine, because she was having side effects from her medicine, and because of the side effects she had to do this risk versus benefit analysis. Her and her doctor did that analysis to understand whether she should continue with the medicine or whether her quality of life is better without the medicine. So unfortunately or fortunately for her, her doctor was good. I will say fortunately. Other people might think that is an unfortunate event, but for me it is a fortunate thing that she decided to not pursue the medications that were harming her health. And now, after having done this, what does that patient need to do? That patient or anyone like me, what I did, one was the radiation from the phone was also impacting, not simply the radiation from my phone, even sun's radiation was impacting my health, because my body's inflammation levels were high from allergies or from poisoning related to cancer. So whatever, or both. So whatever was the root cause of the heightened inflammation, every time I was walking out in the afternoon sun, even though I am an Indian who has grown up in Indian climate, who used to walk to school every day in the hot sun, walk back from school every day in the hot sun, for whom staying out in the hot sun for 1-2 hours in the evening was nothing. For me, sometime, and even in school when we had lunch time and lunch periods, there were times of our school life where for half an hour or 15-20 minutes we are always in the hot sun. Despite that, 5 minutes of going out in this same hot sun was being very distressful for my health. My body was getting sunlight sensitivity, which is also a thyroid related symptom. So and a radiation poisoning related symptom. So because radiation from phone, radiation from the sun, both were impacting me, I started not going out in the sun. If you observe that like I would go out when it is early in the morning or later in the evening, rather than in the middle of the afternoon where the sun's intensity is at peak in India. So those middle hours, or the days when sunlight is really intense, clouds are very less, in those days I wouldn't go out in the hot sun. And in the summertime I wouldn't go out too much in the hot sun. All these practices I started doing. Slowly all the thyroid related symptoms, that's why I started de-escalating for me, even though this was a harder path in terms of how quickly I will get a resolution. If someone has financial crunch or has a lot of time to explore these things like me, should you do that or should you take the easy route? And this was the better route. I'm pretty sure these lesions have the one lesion that I had has gone down, and the nodules that I have, they might also have reduced now in number over time, because if this area is not getting harmed by radiation from the phone, or I have reduced the exposure of the phone. Like earlier I was say using my phone for 15 hours a day, and now I'm only using it for 5 hours. That it significantly reduces the exposure to radioactivity, right? Or earlier I wasn't charging my phone at 100%, but now I use the phone when it is at 100%. That also makes a difference. So these small shifts and changes that I made, and it took a time. It's not that even now also there are certain things like using headphones that I'm not able to do. This is like the C-type charging thing, and I'm having some issues with either using a Bluetooth or even using the C-type connector with a normal headphone. So I don't usually use headphones yet, but that is also a practice. If I have the right phone which doesn't have this C-type glitches or connectivity glitches with Bluetooth, whichever phone will give me those kind of advantages, I should look for those kind of phones. So make the wiser choice. Buy the phone that will not that will not harm your health. Many of us go easily and buy all these cheap phones which are all these, and this is not even a cheap phone. Even then my phone has all these glitches, because even though the phone might have got good rating online, it may not even be a cheap phone. Even then sometimes manufacturers really don't care about their quality, and out of the 100 phones, or if they are selling their phones for to millions of people or billions of people, out of billions of people, even if their 10% phone is bad quality, imagine that many people are now 10% of 1 million or 1 billion customers is a large amount. So that many people end up getting crappy products from them. That is why when you are in a financial crunch, you should make wiser decisions that aid your health, support your health, help you in aiding your life than harming your health. And this was the one pre-cancer thing. For the other cancer thing, I correlated back my breathing problems and skin irritation problem and allergy problems to pesticides in food, pesticides in clothes, pesticides in the air and other environment, not simply pesticides but other chemical contaminations in normal food, clothing, normal things that humans do in their daily life. Because I wasn't even working, I was staying at home, I was leading a quite sedentary life. Maximum activity that I used to do in the last few years before I got hit by cancer is going for 2 hour walks. That's all the max physical activity that I was doing. Despite that, I'm getting cancer. Then from where is it coming? I'm not doing any work where the work hazard is there that will give me cancer. I'm not doing any stressful work that a lot of stress has accumulated in my body that is aiding my cancer. I'm just leading a normal sedentary life at home, and despite that I'm getting cancer symptoms. So where is it coming from? From the environmental toxins in my daily life activities. So if one environmental toxin, like when I first found that there were certain scents in soap, scents in shampoos, and scents in female hygiene products that are escalating my health symptoms, it was not necessarily related to just cancer health symptom but other health symptoms. That because say you have cancer and then you have allergies from other products, if your body has to fight cancer as well as allergies from other products, your immune system is fighting two things at the same time. So your system will get overloaded then. So the more things I reduce from my system that is harming my health, and I eliminate those products from usage, what starts happening, then my body has a better chance of focusing only on those cancer cells and focusing only on fighting the cancer. So if I have cancer and I have other things going wrong with my bodies, which was true about my health, my liver toxins also were showing high elevated liver enzyme levels, showing that my liver was slowly getting toxed out too, which was happening from what? From same thing, pesticides in food, chemical contaminations in the water, chemical contaminations in the clothes, chemical contaminations in the makeup and toiletry products women use. So again, slightly before I had started understanding about my cancer, my allergies were giving me the indicator that allergies of these from these products are causing a health harm to me. So as soon as I stopped using the products that I have control on not using, immediately some of my skin irritation symptom, allergy symptom started de-escalating. So and say I detected that 10 products are causing allergies to me. Out of those 10 products, I have control about the 8 products that I am using personally. I should stop using the 8 products I'm using personally. The other 2 products which I'm not using personally but my neighborhood is using, or my society is using, or my family is using, I can't convince them to use or not use something that is health harming. Even if it is health harming to them, if they don't realize it, I can't do anything about that. That is outside my control. But the things that are in my control, I should take the initiative to stop using that, right? So same way with any other cancer patients, if you do the right due diligence and research, and this guy was a teacher, so being a teacher, he could easily actually sit down, have access to a computer to sit and research what are the cancer causing elements in his daily life, and from that, if he slowly researches and does the right analysis of what cancer causing agents can be eliminated from his mom's life, slowly, even if say she got detected with stage 3 cancer that needs expensive treatment, someone with right preventative strategies can de-escalate their cancer symptoms from a stage 3 cancer to a stage 1 cancer also. Or someone who's in a stage 1 cancer or a pre-cancer level can de-escalate that cancer symptom to a non-cancerous stage as well. Why? Because it's the principle of treating any disease is same. If you are in a pre-diabetic stage and cardiovascular disease state, where certain health indicators are showing that your cardiac health is deteriorating or your sugar levels are high, and so all these things, when you are maybe in the mid range of sugar levels being high, which is pre-diabetes, whatever is happening at that time, if you take the right necessary preventative care steps, better health supportive steps, you can stop getting, you may stop your body from progressing into diabetes, progressing into heart disease, progressing into a higher level of heart disease that will need medicine. And without that, that is true therapy. True therapy is to balance and align your health according to your health needs, and doing the right supportive and preventative care strategies to ensure that you stay in optimal health without medicine, without surgery, without any outside intervention. When should outside intervention be put into place? Only when your health is severely at risk, severely at such a stage where without outside intervention your body might fail to function. That is when you should take the medicine. You need to take the medicine, you must take the medicine, you must do the surgery. But without that, if there are certain things you can de-escalate, even the medicine that you may take, if some person is even in a who's already a diabetic patient, many diabetic patients have seen this also. If they do the right kind of dietary and food changes and health changes and supportive to their health status changes, someone who had to take 4-5 diabetes medicine, sometimes those patients also with the right intervention, right therapy from their healthcare provider, can end up going from taking 5 medicines to only simply 1 medication, because right therapy was involved to balance and align their health, and what was not possible for their body to do, that part the medication is doing. Same way with whatever your body is not able to do, that part the surgery will do. If I had these lumps and these lumps were really cancerous, obviously it is a better, safer choice to get the lumps removed. But until it has gotten cancerous, if by preventative care it can stop getting into the cancerous zone, should I choose that option, or should I wait another 10 years for the cancer to develop and continue my life with the same way, with pain here whenever I'm using radioactive material, or pain here whenever an inflammation on my body whenever I'm going out in the hot sun? If all these factors were impacting maybe one or both of my cancerous symptoms or other symptoms that were then impacting my cancer, whatever was going on in my body, they were all interconnected, because our body is an interconnected system. So that's why even with cancer, if there are things that the lady has herself observed, this mother has observed, or any patient is observing, is impacting their health, harming their health, if you prevent those things that are impacting and harming your health, if you become mindful about your own body and own health, or the health of a loved one, you can de-escalate expensive medicine needing, surgery needing thing into a non-surgical or less intense surgery needing, less expensive therapy needing stage of the disease as well. That potential is present for any one of us. And secondly, even if say you went through the expensive treatment, went through the expensive surgery, after that, if you have already done that, that is fine. But after that, the supportive care that is needed by the patient in their home life is related to this. The supportive care is related to trying to eliminate carcinogens from your daily diet, trying to eliminate carcinogenic exposure. Like if pesticides are escalating my cancer and there is a proven correlated risk of pesticide poisoning or pesticide exposure leading to cancer, should I stop exposures to pesticides in my daily life? Even if say I go today for a cancer treatment, I get treated, after a few months I come back home, should I also ensure that a pesticide free environment stays as far as possible in my life? Or should I continue to consume pesticide ridden food, pesticide laced clothes, pesticide laced water supply? Should I promote that, or should I take the initiative to ensure that the locality that I live, the family that I coexist with, the people I live with, the places I get my water and food from, they all start having no pesticide usages in their choices? Would that be a better and safer and healthier choice for me and everyone else who is going through cancer or organ damage or similar things? Or is it like every time I get cancer, I'll go and take medicine and go and do the surgery? You can do that when you are rich enough, when you have enough money and resources to keep taking medicines and keep doing surgery. But those who don't have enough resources, enough money, enough time, for whom the surgery or medicine is more harmful than beneficial, for all of them the better route is to first try out the preventative steps, the supportive steps to realigning their health towards a better health status. I hope this made sense, and if anyone has any questions, please drop a comment. Know that everyone's disease can be less expensive if people put the right efforts towards making it a less expensive healthcare measure needing disease. Does that make sense? So again, if you have cancer and you have been suggested a really expensive medicine by your doctor that you can't afford, your family can't afford, there are choices and alternatives available. You might have to search for those choices, or if your insurance is preventing from paying for that choice, remember that that is not the only choice. That's why the insurance is refusing to pay for it. There might be some alternative choice that you should try out first for your disease when someone denies a particular therapy to you. So not always, and here comes the question of medical gaslighting, where sometimes people mistakenly think that when a insurance company is preventing to pay for your medicine, or a doctor is suggesting a cheaper therapy, or a doctor is not able to research the ancillary things needed for your therapy, it simply means that you are supposed to take care of your therapy in a way that the doctor you're seeing is unable to see, or the insurance having placed a barrier is placing that barrier because maybe some different kind of therapy is needed for you to manage your illness, manage the disease that you have. And sometimes if you are a person like me, you may have multiple diseases going on, where in fact if your insurance was generous enough to approve that medicine, or you had generous friends who funded your medicine costs, after getting that funding also, if you had taken that medicine, you could have had adverse effects from the medicine, or some partial benefit also only could have happened, because maybe you had 2-3 different diseases going on, and getting that medicine might not have been the only treatment, or getting that surgery might not have been the only thing needed to help you recover from what you are going through. For complete recovery, true recovery, usually other than medicine or surgery, many other things are needed, and those many other things related to nutrition and general lifestyle, general life conditions, general socioeconomic conditions, general family life conditions, these are the factors that are actually more important in supporting a patient's health than actually the surgery. Even though people consider that the doctor doing a surgery is the actual miracle, or doctor prescribing a medicine is the right intervention, it's only a part of the vast series of things that are the real intervention that actually heals a patient or makes them completely recovered from their illnesses. And very few people in the modern lifestyle actually are recovered from their illnesses, because most of the people do not get that complete holistic therapy. That's why there's holistic healing also that has come up. That's why Ayurveda still continues to practice in different countries. That's why many other forms of healing have started coming up, because normal standardized Western medicine doesn't address, or is only meant to address, a partial aspect of someone's healing. Major healing happens from naturally aligning our body towards better health, naturally understanding our body's symptoms, and realigning and balancing our health towards a paradigm that is doable in your normal life, even when medicine is absent, even when surgery is absent. If you are able to realign yourself, well and good. If you aren't able to realign yourself, yes, take medicine and surgery. But if you don't even have the money to go towards medicine and surgery, should you try to realign yourself without the medicine and surgery? your choice, your call. And I hope this was informative. Again, if you have any questions about your own diseases where you're struggling with the finances or struggling with understanding whether you should continue your medicine, you may have a side effect with which your doctor may not be understanding, or you yourself don't understand that you're getting a side effect from your medicine, maybe that's when this video will show up for you. And hopefully it will give you some insights on what direction you may want to take when going through a risk versus benefit dilemma regarding your health, and moral and ethical dilemma like this teacher had when his mom got sick. Thank you very much. Have a great day.